Hello, 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 and welcome to this caregiver preview for puberty and mental health literacy. I am Christy Abel, and on behalf of Rethink Sex Ed, it is my pleasure to present the following information. But before we begin, I would like to acknowledge and appreciate that I am an invited guest in the traditional territory of the Tsawwassen and Musqueam First Nations. I have the privilege to work, learn, play, and live in this beautiful place, and I'm committed to being a steward of this land. I express gratitude to the Coast Salish community and all Hamohoyan-speaking people, and offer my respect to all elders who have gone before us and First Nations people who are with us today. And I encourage you to do the same wherever in the world you may be. Haichka. So who am I? All right. Well, like I said, my name is Christy Abel, and I'm a certified sexual health educator out of the graduate program of rehabilitation medicine at the University of Alberta. I have a master's degree in counseling psychology from UVic and a Bachelor of Education from UBC. And it all started way back in 1994 when I started my Bachelor of English Lit, even though I did not know what I was going to university for, which is a normal thing, by the way. Your kids don't know what they want to do yet. As for my experience, I was a high school teacher from 2001 to 2009, and I really focused on the middle years during that time. I was mostly a grade 8 teacher, so I know all about the adolescent brain and have a lot of experience both in the classroom as well as counseling. I then decided to shift to becoming a counselor, which I still do. It has been a wonderful experience for me being a trusted adult for kids in my building, as well as being able to share my knowledge of mental health. And actually, I was the mental health literacy team lead and trainer in my school district. Mental health literacy is a wonderful program out of UBC and Dalhousie universities, and they're taught all over the province in British Columbia. And I spearheaded that in my district. I was also the district lead for sexual health education for 3 years until #budget cuts, which I'm actually very grateful for because I would not have pursued the becoming certified without it. And I probably wouldn't be doing this if I was still doing that job. So that's okay. And then in 2021, I am the CEO and founder of Rethink Sex Ed, and which is providing this information. In my personal life, I'm a mom of 2 awesome kids with my very patient and partner, Ben, right? We love animals. We have 2 cats. We have a horse. We have fish. I think we're going to get a dog, but don't tell my kids yet. And I love coaching and being coached. I've also had my own therapy practice. Now I'm a YouTuber, and I love being outside. We live by the beach, so I love kayaking, and we love hiking. We love all that kind of stuff. Camping, yay. So who is this for? I wrestled with the age on this a little bit because I feel like the information is appropriate more for like 10 plus. But the reality is that puberty, the onset of puberty, the age is getting earlier and earlier, with being as young as 8 for people born with a vulva and vagina and uterus, and 9 for people born with penis and testicles. Now, this doesn't mean that your kid is going to experience that, but statistics are now showing that the onset is typically between 8 and 13. Okay, so it's also for anyone who wants like an accessible, this is made for kids, right? So refresher mini course. I am not going to delve into too far into things like the different mental health conditions, except for anxiety and depression, because those are the 2 most presenting mental illnesses in my practice, and I believe across the board pretty much for teenagers. Of course, others exist, but these are the ones that we would see the most. I'll define the difference between mental health, mental distress, mental problems, and mental illnesses. This is also for caregivers who want to provide their children with accurate information in regards to like teen angst and like what it is and how it's normal, but most importantly, importantly, like how you can help your kids as well as how they can help themselves. Of course, I never leave out the LGBTQ2S plus community. So we'll have a little, a small portion on what it might be like to be transitioning as a teenager, and also to be questioning one's sexual orientation or gender identity. And also for you caregivers who are like, what's going on with my kid? Okay, so I hope this is very helpful for you in explaining the why. Okay, let's get started with good old teen angst. If you're an adult, you know what it was, but you may have forgotten how intense it can be. Okay, it's an intense emotional state where little things become real big, real fast, and it can seem to often come out of nowhere, right? So we might be familiar with angry outbursts and tears, stomping of stairs, loud slamming of doors, that kind of stuff. And you might go, what did I do? And sometimes, like, these are not limited to, right? But like you saying no to them, right? They could be having a social issue at school or in the community. They could be having a romantic setback, feeling some disappointment or rejection. They could be struggling in school and like not feel comfortable sharing that. Or you know what? Just plain old hormones. And we're going to talk about the pituitary gland in the presentation. Okay, so sometimes they might want to start arguments seemingly just to want to start them and have them, and then have more pronounced mood swings where things like 1 second they're flying high and the next minute they're like super low. All right, so these are all normal. Okay, and other typical teen years. I will do another presentation on like the process of growing up, because I think it's really important that everybody understands, you know, separation and differentiation. And anyways, there's a whole bunch of them. But you can expect, right? Now, it doesn't mean that you have to tolerate these things, right? What means it has to be to find a way to work with them, but also understanding that this is actually okay. All right. Like it's not maybe okay, but it's typical, it's normal, it's part of it. It's part of them pushing you away to see where you're gonna land. Okay, so teenagers need to do this. They need to differentiate, and they need to push you away so that they can figure out who they are. Okay, so they might be rude about it. They might be short-tempered. They may want to sleep more, but not at night. They may want to play loud music. Thank goodness for our earbuds. They may feel self-conscious about their changing bodies. It is very typical for them to have a messy bedroom. I am okay with my kids having a messy bedroom. It's easy enough to close it. As long as like pizza boxes aren't crawling out from under the bed, I am okay with that because it's their personal space. I do make them clean it up about once every week or two, but just to kind of like find where things are. And also they'll take more risks. Adolescents are championship risk takers. It's actually probably one of the most scary things about them is that they can be impulsive and don't think about what they're doing. And then they take more risks because again, they're like testing limits on who they are and how they want to be in the world. All right, so how can you help them through this angsty period? I know it seems hard, but they need to get more sleep at night. Okay. So if they don't, they get surly and annoyed, which is hard for everybody to live with. Now, the biggest, and I've seen this over and over and over again in my practice, having tech in their bedroom, whether it's a laptop, a phone, an iPad, a tablet, a desktop, it doesn't matter. This is the thing that is robbing your kid of sleep, 100%, even if it's not them. Okay, so, but I'll tell you right now, there's a lot of kids up at 2, 3 in the morning on a weekday, and they're going to send out messages saying, who's up, who's up, who's up, who's up. And if your kid's phone is dinging, it's going to wake them up and disrupt their sleep. In our house, the rule is the phones go away at 10 p.m., right? So and we have like a communal space. My kid likes to listen to ASMR as he falls asleep. So we just have it in the hallway, right? Like on a desk, and it's outside. And then he gets to listen to his stuff that he wants, but he cannot have it in his room. And then they get it back at 7 o'clock in the morning. But my kids, well, I can't do that. My kid's alarm clock is their phone. Yeah, that may be the case, but I'll tell you right now, go get an alarm clock, okay? they will probably be if you don't have this in place already, or if they don't have a phone yet, you want to make sure you do this. It is a very, very important for other reasons too. All of the stuff that has to do with photos and stuff like that happens between 10 p.m. and 7 a.m. So that's another good reason not to have them. So hand over their devices at a certain time each night. You can even do a communal charging station. There's a bunch of stuff that you can do to make this work. Okay, number 2, try not to lecture. Ooh. Okay, so at first impulse, we want to lecture them about the things that you're concerned about. So this is, don't cave into the knee-jerk response, take a breath and realize it's time to listen. One of the philosophies I have in life, and I have many, many, many of them, is first seek to understand, then to be understood. This will be very, very helpful with your teenager, okay? Teens, they enjoy having a forum where they can safely, explain their actions or feelings without an instant reaction, This is going to be, it's just going to push them away. So you want to give them the space to open up, and then you'll actually start to learn more about them. So you'll say like, oh, please share with me. But then when they do, you're like, ah, like, no, that's not how it works. That'll just shut them down right away. Okay, we also want to resist getting angry. Okay, so adolescents are hardwired to push back against, pardon me, their caregivers. Okay, they are hardwired to do it. It is in the process of growing up. So resist the urge to lash out. When they say something rude or mean, yeah, it hurts, but it's not, when you show them that it hurts you, you are giving them that power. It's like whenever I'm dealing with like a bullying and victim situation, my first advice to the victim, because it's usually the victim who's reporting, right, is like, table your reaction, right? Like you look at, oh, that's nice, right? If they're looking for something, right, when they're doing this. And sometimes they're not doing it on purpose, right? It's those points that the pituitary gland going, I'm in charge, right? But they often don't mean to, right? So you can, if you're like, okay, right? Pause, take a deep breath, walk away, be like, no, not today, dear, right? And sometimes they just need to burn it off, right? So sometimes I'll just be like, do you just need some alone time? And he'll go, yeah, I kind of do. And then I would often, if it's not after 10, I'll be like, take your phone, go in there, talk to a friend. I don't care, right? And then they come out. I'll be like, come out when you're ready, right? And we don't even need to talk. I'm just like, come out when you're not like freaking out. We want to keep the open door for chats, right? So again, teenagers are resistant often to talking to their parents, but that's because they're often afraid of getting into trouble or having their freedoms restricted if they're honest about what they are doing. So let them know that you're welcome. You welcome chat time. Let them know that you welcome it, right? Now, they may never ever take you up on it. But here's the thing is, the door, you're the adult. You need to do the role modeling, right? So when they do have troubles, or like, let's say their friend told them something really that scared them, right? Like that they're thinking about suicide or something, which I'm going to touch briefly on in this because we can't talk about mental health in teenagers without that, right? But it'll give them the space to be able to come and tell you and trust you. Okay. And then if they can sit and talk to you, even if it's about like random things, right? It gives them that sense of security and safety. And they live in a very stressful and confusing world where they're being bombarded with information all the time. I mean, we are too, but our filter's a lot different, right? Their prefrontal cortex is like 2.5 times more active than ours are as an adult. Okay, let's also try not to take it personally. Okay, they don't really hate you. They don't think you're the worst. All right, attachment is an interesting thing. Attachment is those invisible strings that join us to the people that we care about. And so they love you still, even when they say they hate you. Okay, if they do, you can always address that. Like if my kid said they hated me, I'd be like, it's a very, very strong word. Let's talk about other emotions that aren't as strong. Anyways, another presentation. So, but it's really common to push back. Oh yeah, right? You're going to be like that? I'll show you. Yeah, you'll show them what not to do. Okay. So we want to resist taking these like arrows too personally and just recognize this is not them. Okay, so I have this theory that kids are just so cute when they're little, so that when they become adolescents, we don't just push them out of the house and say, you're on your own, okay? Because it can be really, really challenging. But it is for everybody. But I promise you, if you've done your job as with attachment, then this will not be an issue. They will come back. I promise they'll come back. And it's usually kind of like 17, 18, when they've leveled out, right? And we want to encourage exercise, right? Kids are getting less and less exercise. Again, in our family, we are guilty of this. I try to model it. I go to the gym like 5 times a week, but my 12-year-old could not care less. He's like, okay with like, anyways, he does what he wants, but it's just like, he's not one of these kids that's on 10 sport teams or anything like that. Okay, so it's a good mood booster to exercise and get off their phone and off the couch and onto the pavement, or just doing something, right? Doing some movement. Movement allows more good hormones to be released, like endorphins and dopamine and that kind of stuff. And it leads to a better mood. And again, like, you can't tell them to get off the couch and go do something and go exercise if you're not going to do it too. So it's actually good for everybody to adopt this as a philosophy. Okay, so now we're going to talk about shift over. Is it angst or is it mental illness? Because guess what? Mental illness is very prevalent amongst young people, with the average onset being 14 and a half years. Anyways, so there's some warning signs that you should reach out to your like medical professional or mental health practitioner about. So sudden like weight loss or gain, sleep problems beyond, especially after you've taken away their phone at night. Okay, if they're having and tech, okay, not just phones, extreme fatigue, like, I can't get off the couch, I'm so tired. Now, we always want to also get a checkup for things like low iron, right? There's all sorts of things that could be causing some of these things that are physical. I always say, go and get physical, like get their blood drawn, all that kind of stuff. Get the tests if you're seeing any of these first, because what if there is a vitamin deficiency, or there's just something going on, or whatever, like there's something physically going on. We want to eliminate that before we assume that it's mental illness. Okay, anger issues, angry outbursts, self-harm. Self-harm comes in all sorts. It's got so many faces. Oh my goodness, from cutting to burning to pulling out hair. There's a whole bunch of stuff like that. Any type of self-harm other than, like, I guess, biting your nails. Technically, I mean, I was a nail biter for like 30 years. So, but technically it is self-harm, right? I mean, so is getting a tattoo and earrings, but you'll see what I mean. When they're using it as a coping mechanism, then we have to take a look at it in terms of mental illness. Feelings of intense sadness and despair over like across, without a reason, like, like if a family pet dies, they're going to feel sadness and despair for some time, right? So that would be a reason. That's not mental illness. That's actually a mental health problem, which I'll discuss in the video. Extreme mania, which is when somebody seems like very out of control and very high energy. Substance misuse, irrational fear, so being afraid of things like that are basic. Impulsive high risk behaviors to a certain degree, that is okay with teenagers, but you'll have to, your kid, right? Everybody's got a baseline of their behavior, of what is kind of like typical for them. And when we look at mental health, what we're looking at is variations from that baseline. Intense mood swings, more so than angsty and suicidal thoughts or actions. Teenagers, it's very, very common for them to think about suicide. It is not common to make a plan, start getting the means, all that kind of stuff. Okay, so, but we always want to talk, and I'm going to encourage them to talk to you or to other trusted adults. well, I lost that. Whoops. Anyways, we got the idea. Okay, so the WHO, globally, it's estimated that 1 in 7, about 14% of 10 to 19-year-olds experience mental health conditions, yet mostly they are unrecognized and untreated. So depression, anxiety, and behavioral disorders are amongst the leading causes, and disability among adolescents. And suicide is the 4th leading cause of death amongst 15 to 29-year-olds. Okay, so kids with mental health conditions are vulnerable to social exclusion, discrimination, stigma, which I will address in the following video, educational difficulties, they'll take more risks, physical health, and human rights violations. So we need to recognize that this is a thing. When kids come into my office, when teenagers come into my office, about half the time, their caregivers, parents, don't believe that mental health is like a thing. Okay, so they are not getting the help that they get at home, that they need at home. And so they're looking for it elsewhere. And so if I can implore anything of you as an adult, is that if your kid is concerned, like, believe them. Okay. All right. And then the onset is average is 14 and a half years, like I mentioned before. Okay. So just like with any type of condition, whether it's physical or neurotypical or whatever, the earliest that we can intervene, the better the results with treatment, right? So basically, okay, almost 50% of patients, mental disorders start before they reach adulthood. So early intervention. So again, your kid, if they come to you or you start to notice this stuff, it's really, really important that we get it earlier. It really, really helps. Now, I am not suggesting that you put your kid on medication. Okay. That is actually not, I'm neither for nor against medication. However, that's a decision between you and doctors and whatnot. That being said, I know several kids that like can't walk through the door of a school without it. So that's their thing. Right. And it also doesn't solve the problems and the disordered thinking. So therapy, counseling, talking it out is very, very, very important to shifting what's called our neuroplasticity, which is the brain's ability to change itself. And it's actually why therapy and counseling work. Okay. We need to take this seriously. And when parents and caregivers will sometimes think, well, oh, they'll just grow out of it, right? Or it's just a phase. Now, teen angst is a phase. Mental illness is not. Okay, so this is why we need to understand about both of them.
As patron of the UNESCO Child and Family Research Centre, it gives me great pleasure to introduce this youth research video. The centre believes that young people researching and talking to other young people about what issues directly affect them can give us a powerful insight into what matters in their lives. Ensuring the voices of young people are heard is an issue close to my heart. Research driven by youth can enable young people to add their voices and influence change on issues that matter to them. As part of the UNESCO Child and Family Research Centre team at NUI Galway, youth researchers have been formally trained in research methods and have undertaken ethical and scientifically grounded social research projects. The following video is an example of how their research can be used as a tool to advocate for change. Cala Foróige and UNESCO Centre Youth Research Group set out to explore the link between non-conforming sexualities and gender identities and negative mental health in the case of young LGBT people before they came out. Supported by the UNESCO Centre, the young researchers wanted to build on research that has already been done nationally in this area before bringing the experience of the people in their locality to the fore. First, they reviewed existing research carried out by research centres and youth work organisations working with LGBT youth. Then they asked 20 LGBT people between the ages of 15 and 18 about their experiences. They conducted surveys online, and using these methods, they received very personal experiences and stories, which they could then compare to the data they had already accumulated. Here are the Tala Research Group's findings.
We need more services for LGBT young people before curfew. More awareness and consequences for LGBT bullying needs to be implemented in schools to allow LGBT people to flourish in the school environment.
A larger study needs to be done to raise awareness and fundraising for the programs and services that our LGBT youth need.
We want more education in schools supporting LGBT young people.
We need more information for young people to make them more aware of the importance of supporting their peers, as lack of support is a common issue faced by LGBT youth.
We need more information about homophobic bullying in schools.
Specifically about the use of homophobic slur words and how they affect young people.
Okay, whew, something about that piano, man. It's hard. I do have something in the works for young people aged 9 to 12 about SOGI, which is what in BC is sexual orientation and gender identity. Now, why is this important in terms of mental health? LGBTQ2S people face higher rates of depression, anxiety, OCD, and phobic disorders, suicidality, self-harm, and substance use. There is double the risk for post-traumatic stress disorder than for heterosexual people. Okay, and LGBTQ2S plus and youth and trans people face an increased risk 14 times more of suicide and substance abuse than their heterosexual peers, and 77%, this is from a Canadian study, of trans respondents had seriously considered suicide, and 45% had already attempted suicide. So in terms of mental health, this is a significant. Okay, so key factors. So what can adults do? Okay, so the things that are the most important are support from family and friends, supportive schools, workplaces, and neighborhoods. Now, lower levels of internalized homophobia, which is the person has for themselves, which is fostered and supported through making connections with other LGBTQ2S plus individuals. Also supporting them in their experiences of coming out, and then of course addressing the social determinants of health, which is a much bigger issue, but I didn't want to leave it out. Okay, so we're going to wrap up and move on to the main event. So I do not consent for my videos to be shown in schools nor organizations without my explicit written consent. However, you as the caregiver, please, if you find that what I have to offer, I would love it if you would like, subscribe, and share with other parents, guardians, and caregivers who think could benefit with, or their kids could benefit. When I make these videos, I make them, when you upload a video to YouTube, it says like, yes, made for kids, no, not made for kids. Even though this is made for kids, I want you to be the gatekeepers of the information. And if your kids' settings, their safe search settings are where they should be. And if you don't know what that is, in the pornography literacy caregiver preview, I have 5 things that you can do to kind of lock down the more adult content on your kid's phone. So they shouldn't, if that's on there, they shouldn't come across me. Okay. Now, I genuinely appreciate you taking the time to consider what I have to offer. And if you choose to move forward with showing this to your young people in your life, then it's an honor.